Thank you. Thank you. So good morning, afternoon, good evening, and I would like to thank the organizers for giving me an opportunity to present our research work, which was previously published in 2021 as well. And it's basically that we all are fully aware that the coronavirus pandemic has stretched the entire global health system to its maximum limit. And as we are fully aware, there's a significant overlap between coronavirus and influenza A2. And that was the reason why we undertook this particular study, to sensitize and to make people aware that there is a need to screen influenza A patients with COVID-19 and vice versa, especially those who are at high risk. So our aim and objectives was the incidence of influenza in COVID-19 pandemic admitted during the COVID-19 global pandemic in a multi-specialty hospital in Rajasthan. As we all are aware that coronavirus is it's gone, and I won't say it's gone, but it's still persisting in the community with a low virulence, and it will be popping up from time to time. And with the ongoing winter season in the Northern Hemisphere, there is a risk, or there is with the seasonal flu, it might come up in the circulation. So COVID-19 and influenza are both contagious respiratory illnesses and share many common characteristics with similar mode of transmission and symptoms. Co-infections with respiratory pathogens in patients with COVID-19 have been observed with varying frequencies that we have already, we undertook the literature review and found that there has been a geographical variation in the incidence of influenza A2 in COVID-19 pandemic. Due to their similar presentation, there may be delay in the diagnosis and initiation of proper treatment of the two conditions. So this study was undertaken to estimate the incidence of influenza A in COVID-19 patients. And this was a cross-sectional study which was performed in Department of Internal Medicine at Fortis Escorts Hospital in Jaipur, Rajasthan, in which we estimated the incidence of influenza A. Can I have the next slide, please? The next one. Thank you. So we estimated the incidence of influenza A co-infection in 101 COVID-19 patients from 1st of August 2020 to 31st of December 2020. All patients were tested for influenza viruses and its strain using real-time reverse transcription polymerase chain reaction from the upper respiratory tract samples. We also compared the epidemiological and clinical parameters of co-infected patients with those with only COVID-19. And this study was approved by the Institutional Ethical Board of Fortis Escorts Hospital, Jaipur. Can I have the next, please? We analyzed 101 COVID-19 patients. Previous one? Can I have the previous one? Yeah. So we analyzed the data of 101 COVID-19 patients admitted from 1st of August 2020 to 31st of December 2020 and found that out of 101 COVID-19 patients, 9 were co-infected with influenza virus with the incidence of 8.9%. We observed the co-infected patients had a significantly higher median total leukocyte count of around 13,000 compared to the TLC of only 9,300 in the COVID-19 group, making it significant. We also found a higher neutrophil count along with the increase in pro-inflammatory markers and organ dysfunction in non-survivors with COVID-19 influenza co-infection patients. The inflammatory markers were also elevated, like the serum C-reactive protein were also higher in co-infected patients than in those with only COVID-19. However, this difference was not statistically significant. Similarly, the median neutrophil lymphocyte ratio was also significantly higher in the co-infection group. And a high neutrophil lymphocyte ratio is often reported in case of hyperinflammation, as we all are aware about it, which can occur both due to severe COVID as well as influenza infection, and has been consistently associated with adverse COVID-19 outcomes. Now, the duration of hospital stay was also prolonged in co-infected patients. Can I have the next one? Can I have the next slide, please? So to conclude, the incidence of influenza A in coronavirus was 8.9% in our study, but we have observed in the literature review that there has been a significant variation and variability in different parts of the world. The co-infected patients had a significantly higher inflammatory response with more severe form of disease as compared to isolated coronavirus disease. And the duration of stay in hospital was also prolonged with more risk of complications like ARDS, acute myocardial injury, acute kidney injury, secondary bacterial infections, and ventricular-associated pneumonia. The high-risk coronavirus patients with comorbidity must be screened for influenza A virus. More extensive studies are required to understand the interaction between influenza A and coronavirus disease. Thank you.